Oh, thank you for coming in today.
Pleasure. I'm excited to be here.
Awesome, that's great. So just to reiterate, we'll be going through a pre-screen this morning. And basically that's just an opportunity for you to tell me a little bit about yourself, your medical conditions, what you'd like to achieve moving forward. Awesome. And just so you know, I've just provided you with a code of ethical practice, so you can read through that. As a registered exercise professional, I have professional standards that I follow.
Okay,
so
that's good to know.
You may like to read through that. Also to let you know that this pre-screen is confidential, and you have rights, so you have the right to withdrawal, the right to the privacy, and a non-participation as well. So if there's any questions that you feel uncomfortable, if you don't want to answer, let me know and then we can address that. Cool. So you're happy to proceed?
Yeah, definitely.
Awesome. So I'm just going to get you to fill out just that first little bit of information just there, just your name and that bit there.
Cool.
So did you manage to find the gym all right?
Yeah, real easy. I'm just like around the corner from work, so it was real easy to find.
Awesome. And this is your lunch break?
Yeah.
Perfect. Excellent. I'll grab that from there. Awesome, Ria. So this first little section is just about your medical information. So I'll just talk through the questions, and you can just let me know if they apply to you or not. So cardiovascular and pulmonary conditions. Have you been diagnosed with any heart condition, stroke, anything like that? No. Awesome. Do you have any family history, say father or brother under 55 years old, or mother or sister under 65 years old with a history of heart disease or stroke? No. Awesome. And you're a female under 55? Awesome.
Yes.
Do you know if you have high blood pressure?
No,
that's fine. We'll take your blood pressure at a later stage as well, just to confirm that. Perfect. Are you asthmatic?
No.
Are you smoking?
No,
Smoker?
definitely not.
No. Awesome. Are you currently active?
Yeah. I try and train like 3 times a week on average, so
perfect.
That's regular, right?
Yep. And body composition, do you know your current BMI, waist to hip ratio?
No idea.
That's fine. We'll take that. We'll take that afterwards as well. Bone and joint. So do you have any known bone or joint issues?
No.
That could be aggravated by exercise?
No, I've just got like a sore lower back at the moment, but I don't think that's really like a joint issue.
Okay.
Yeah.
We'll look at a little bit deeper into that a little bit further down the track. So that's fine. Any other conditions that may increase an adverse reaction to exercise? No?
No, not that I'm aware of.
Awesome. Cool. Perfect. So just the next section here is just about your, I guess, your physical body. So you did mention that you had a lower back.
Yeah, it's just kind of like, I think, just a bit stiff, or I'm not really sure. It's like it's been playing up, but nothing, like I said, nothing serious. Yeah.
Sure. So tell me a little bit more about that. What happened? Like, when did it first start to come about?
I've probably noticed it like in the last couple of months more than anything.
Last couple of months?
Yeah.
Okay.
Yeah.
So we're in August. So just about August now.
Yeah.
It's around about June.
Yeah, kind of like around that time.
Okay.
Yeah.
And was there anything that particularly happened? Was there any physical impact, or was there any changes that happened around that time?
The only thing I can think of is just changing jobs, like around that time.
Okay.
So yeah, like no injury in training or anything like that.
Sure.
And, like slip and fall.
Perfect. And tell me a little bit about the change in jobs.
So previously I was working in the restaurant, so like in hospitality and just on my feet all the time, so just like moving around. And I've just recently gotten into an office job, so I'm sitting down a lot.
Okay.
Yeah.
That kind of makes sense. Yeah, and that's just sort of come about, your lower back pain has come about since you've...
actually. Yeah, I mean, like I said, I kind of gradually noticed it, but it makes sense, I guess.
No worries. So we can have a look at that in a little bit more depth.
Yeah.
Have you had any treatment for that?
No.
No?
No.
Okay.
No.
And
it hasn't been like bad.
Hasn't been that bad?
No.
So on a scale to 1 to 10, 10 being high, like painful?
No. Definitely.
0 being not painful?
Not like that.
Where would it sit?
Probably like 4 to 5 at the most.
4 to 5? Okay. And does that increase, does that get aggravated with exercise?
Not that I've noticed. It's
No.
just kind of like, I feel like I notice it more like in the morning, like if I'm a little bit stiff, but more so during the day as well when I'm like at work.
Sure, perfect.
Yeah.
And do you just want to just draw just on this diagram here exactly where it is?
Yeah.
Okay, perfect. No worries, awesome. Are there any other sort of musculoskeletal, so any major pain or injury you have to your body at all? No? Okay, perfect, awesome. And have you been pregnant in the last 12 months or are you currently pregnant?
No.
Cool. Are you epileptic?
No.
No.
Not on any medication.
No medication. Arthritis? No. Cool. And no medications. Perfect. Oh, well, it looks like you're in pretty good health. I'll just get you to read the informed consent form just down the bottom.
Okay.
And if you can just sign, that'll be great. So, yeah, looks like you're in pretty good health. So we'll just move on to, I guess, your goals and what brings you into the gym.
Yeah.
So I guess before we get into that, is there anything that, I guess, what have you been currently doing?
Just a mix of everything. Like I just like variety, but I've really enjoyed running and just kind of like training in the gym. But I just like to mix it up.
Sure.
Yeah.
So a bit of weights as well?
Yeah.
Yep.
Weights, classes, yeah, just anything really.
Perfect. And is there anything that you dislike?
Burpees.
Burpees? Yeah, I'm not a fan of burpees, so we're on the same page there. Extra burpees. Nah. Awesome. And I guess, you know, big picture goals, what is it that you'd like to achieve, let's say ultimately, with your health and well-being? What brings you into the gym?
I'd probably say like I definitely want to like get a bit stronger in my upper body. Like I feel like I could, you know, like focus around that specifically. I don't know, like maybe see if I can just like, you know,
like increase
your just increase my strength.
Yep.
Yeah.
Anywhere in particular when you say upper body?
Yeah, I always feel like my chest is pretty weak.
Okay.
So.
Your chest. Okay.
Yeah.
And what would be a target? What would be something that would, I guess, make you realize that you've reached this goal of increasing your upper body strength, in particular your chest? Is there anything that you'd like to do?
Yeah, probably like bench my own weight.
Bench press your own weight?
Yeah.
Okay.
If I really had to think about it, because yeah, push-ups, like they're not easy, but I can do well with them.
Yeah, sure.
But anytime like I try bench pressing in the gym,
yep,
hopeless.
Okay. No worries. You can definitely achieve that. That's not a problem. And what's your current weight? So what kind of?
About 55 on average.
Okay, about 55. Yeah. Cool. And what do you think you can currently do? So at that weight, can you bench press? Like, how much weight do you think you can bench press at the moment?
Maybe like 5 on each side, I think, is what.
5 kilos on each side.
Yeah.
So so the bar's 20 plus 5 on each side is 30.
Yeah.
Okay. So you're currently bench pressing 30 kilos, and you'd like to do 55 kilos.
Yeah.
Big picture. Awesome. And when would you like to achieve that?
Probably, yeah, like maybe summer, by summer, end of summer would
be
good.
January?
Yeah, December, January.
December, January?
That's good.
Okay. Yeah. Awesome. So currently we're coming into August, so September, October, November, December, January. So we're looking about, say, 5 months to achieve that. Perfect. Cool. So a good sort of interim goal, maybe looking at the 3-month mark. You're currently around about 30. So maybe getting your upper body strength, your chest, your bench press in particular,
Yeah.
up to around about 40, 45. Would you be happy with that in 3 months?
Yeah, definitely.
Okay, cool. So let's say 45 in the next 3 months.
Cool.
Awesome. Is there anything else that you'd like to achieve, like with your health and fitness, big picture? Like,
I
have
do
you
like
ever,
running, and I've kind of like thought to get into an event recently as well. So yeah, maybe like do a half or a full marathon. What do you
full
think?
marathon?
Yeah.
Let's go full marathon. I
Cool.
reckon you can do full marathon. Why not?
Yeah.
Yep.
Sweet.
So you're looking at about like 42 Ks for a full marathon?
Yeah.
Yep. Cool.
Yeah.
And when would you like to achieve this?
I'd probably say like anything between like a year maximum to
1
like
year?
something around that.
Yep. Is there
Yeah.
any marathons around about that time that you know of?
I think in March to April is like when some of them kick off again.
Yep.
Yeah.
Okay, so let's aim for March.
Yeah.
Okay. So again, we're in August, September, October, November, December, January, February, March. So we're looking at about 7 months. So
Cool.
7 to 8 months.
Yeah.
Cool. And what are you currently? I guess what kind of distance can you do at the moment?
At the moment, it's 16K on average.
16 Ks.
Yeah.
Okay. And how do you have you been running 16 Ks? Yeah. And where do you do that? Do you,
Just out on the road, like
Out on the
just
roads?
around the neighborhoods, that
Okay.
kind of stuff.
so you've got a bit of a road map,
Yeah.
and it's approximately 16 Ks.
Yeah.
Cool.
Yeah.
Awesome.
Yeah.
And do you know what time that you do that?
From memory, I think it was about an hour and 15.
Hour and 15?
Average, something like that.
Okay. Cool.
120.
Awesome.
Yeah, somewhere around there.
Okay. Perfect.
Yeah, can't remember.
All right.
A couple of weeks.
Couple of weeks, no worries. So yeah, I guess a short-term goal maybe in the next 3 months. You're currently sitting around about 16 Ks. You'd like to get to that 42. So the halfway point is probably anything around about that 30, say 30 to 35
Okay.
K mark.
Yeah.
So maybe 30 actually. In 3 months, how does that sound? If you could achieve 30 Ks in
I'd be
the next 3
stoked.
months, you'd be stoked. Awesome.
Yeah, that'd be awesome.
So let's do that, 30 Ks in the next 3 months. Awesome, fantastic. Is there anything else that you kind of like, a lot of these goals come hand in hand. So, whilst you're gaining your strength and also your aerobic fitness, you tend to achieve other things as well. Is there anything in particular you'd like to achieve?
Maybe
What do you
just tighten my core, like maybe just
Core strength?
Yeah, core strength, or just kind of like have it a little bit slimmer.
Slimmer?
I don't know. Yeah.
Yeah, sure,
I
no
think that'd
worries.
be awesome. Like if we were looking at something aesthetically, so to say, physically to view, yeah.
Okay.
Yeah, that'd be awesome.
Yeah, no worries. You haven't got any issues that I'm aware of, which is perfect. So you're in good health. Just in regards to your lower back pain, what we could probably look at doing is just having a look at your posture. You did mention tightening up your core, so a lot of the times, especially if you're sedentary, sitting down, it tends to disengage abdominals. Probably look at strengthening up your glutes and hamstrings as well. Big picture, you're looking at increasing your strength. So you'd like to bench press your body weight, which is at the moment 55 kilos.
The average, yeah.
Yep.
Like around that.
And in the interim, say in the next 3 months, we're looking at maybe increasing that to 45 kilos. How's that sound? Good?
Yeah, no, that'd be awesome.
Awesome. And your long-term goal with your running is to do a marathon. So you're looking at 42 Ks. At the moment, you're doing 16 Ks.
Yeah.
So another, say, short-term goal within that 3 months, we can increase that to 30 Ks. Sound
That'd
good?
be cool. That'd be-
Awesome.
Yeah.
What we can do as well, just to monitor this, is we'll do some specific testing. So we can do a strength test for your upper body, a bench press in particular, and then we can do maybe something like a Queen's College step test, just to measure your current aerobic fitness,
Okay.
and then see your improvements later on down the track. Just in regards to your core as well, we can do some girth measurements, just find out where you're currently at. Maybe look at doing some skin folds,
Okay.
just to see what your current body fat is as well.
Yep.
Would you be happy with that?
Yeah, I'd be keen.
Awesome.
Yeah.
What I can
Good
do,
to know.
what I can do as well as your personal trainer, I can give you a little bit of a diet log. So energy in, energy out is going to be crucial for you to maintain and to achieve these goals.
Yeah.
So we can have a look at, you know, what you're eating prior to training, even during training and after training.
Okay.
Just so you know, I'm not a nutritionist, but you know, I can give you some sort of guidelines and advice around that. I can write you out a specific program in regards to your increasing your strength, the upper body, and also a cardiovascular program to ensure that you're achieving your running goals as well.
Nice.
I charge $30 for half an hour. So yeah, I just let you know that. And what we'll do next is we'll book in to do your tests. Okay. So we'll do your resting tests. So we'll go over your blood pressure, your BMI, we'll do those skin folds, and then also the active tests, which will be the strength tests, so the bench press, and then also your Queen's College step test.
Sweet.
We might even throw in maybe a core test as well, a muscular endurance, just for your core, because that's something that you'll also want to achieve.
Yeah.
Awesome. Oh, cool. Awesome. Thanks for coming in today.
Pleasure.
And
awesome.
We'll book in for your testing. When are you coming into the gym next?
Tomorrow.
Tomorrow? Yeah. What time?
Yeah, same time, like around lunchtime usually works pretty well.
Same time, around about 11?
Yeah.
Awesome. I'll be here at 11.
Okay.
And I can meet you just at the front desk.
Great.
And we can get stuck into it.
Nice.
Sound good?
Yeah, definitely.
See you tomorrow.
Great.
Cool.
Look forward to it.
All right.
Thanks.